Dr. Tan here. I'm going to speak about my favorite procedure to do, which is nose augmentation, on how you can achieve a higher nose bridge and a sharper nose tip. So at Mizu, on average a day, we do roughly maybe between 3 to 5 noses. That adds up to quite a lot of cases a year. The thing is, everybody's nose is slightly different. So we do every nose in a very different way. First of all, we need to understand how the nose structure is. So the nose is made up of bone, flesh and skin. Procedures that we usually do for noses would be either a nose thread, a nose filler, or a combination of both. So when it comes to different noses, we need to understand that nose threads are very similar in terms of structure to our bone, and fillers are more similar to flesh. So in order for the nose to look natural, we need to have the right proportion of bone to flesh, threads to fillers. If your nose is a nose that is very bony, for example like your knuckles, noses like that we will tend to either use fillers or combination of threads and fillers. If you use more threads, it will just tend to make it look more bony or very thin. So some noses look very unnatural because they are after they're done, it's very thin in the middle, and that's too much threads or essentially not enough flesh. If your nose is very fleshy, let's say for example like a tongue, so noses like that we will use more threads in order to give it more structure and definition. We try not to use fillers, especially fillers that can increase the volume of the nose. So sometimes we use a combination of both essentially to make up for different purposes. There are different advantages of threads and fillers. The advantage of a thread would be it gives you more definition, gives you more structure. At the same time, it increases the height of the nose. The advantage of a filler would be that it gives you more volume, which means that more height on the nose compared to threads. However, it does not give you that definition that threads will give. There's one main advantage of fillers over threads. It is that you can inject different amounts of filler at different parts of the nose to essentially shape the nose. Threads goes in uniformly and increases the height of the nose at the same height for the whole part of the bridge. So if you have a bump, the threads will actually increase the height of the bump. So it does not straighten out the bump completely. If you are using fillers, you can inject fillers above the bump and below the bump and make the contour of the nose smoother. After the local anesthesia is being injected, you should not feel any pain during the insertion of the threads. During the procedure itself, we will decide on how many threads is needed according to the amount of space in the nose, according to the height that we want to achieve as well. There will be a small wound on the tip of the nose which will last maybe for a day or two, and a mark that will go away after a few days. One of the main questions that people always ask me about nose fillers is whether it migrates. Technically, fillers do not migrate on the nose. A few reasons why people think that nose fillers migrate. Number one, if too much fillers are being injected in that area, the pressure from the surrounding tissue and skin will actually compress the filler and cause it to spread outwards and make it look broader. Second reason why people think that fillers will migrate is because if fillers are injected in the wrong plane of the tissue or wrong depth, it actually can move to different areas. But this does not apply to the nose. This applies mainly to areas like the temples, where there is a connective tissue or layer of tissue called fascia. The other reason for noses becoming broader using fillers is because the wrong type of fillers is being used. There are many different types of fillers. Property of the fillers makes a big difference. Some fillers are softer and some fillers are essentially harder. So softer fillers tend to be compressed more so it looks broader. So some fillers tend to absorb more water, and initially when you just do the nose fillers, it will look quite nice and really nice. But over a few months, when it absorbs water, it becomes broader and bigger and makes the nose look thicker essentially. So the right choice of fillers is very important. On our website, there are a few fillers that we do not think is best for the nose, and which fillers are essentially more suitable for nose shaping. Lots of people are worried about the side effects. One of the more dangerous side effects of nose fillers is that it can cause visual impairment if injected wrongly into the wrong areas. If the fillers are injected into a blood vessel, it can essentially block up the blood vessels and cause visual impairment. That's why it's very important to make sure that you go to a doctor that knows where these structures are and take precautions to make sure that these side effects do not happen. Majority of complications from nose fillers we see online are actually done at non-licensed practitioners such as beauty salons or even home-based beauticians. It's very, very important to get your fillers done at a doctor and at an experienced doctor, because if these side effects were to arise, these are the doctors that will know how to counter these side effects as well. So as we can see, nose fillers are not necessarily bad for you. Different noses require either threads, fillers, or a combination of both. When it comes to fillers, the most important thing is essentially choosing the right filler, injecting the right amount, and injecting it at the right place. I would say everybody's nose is different again. In order to find out which procedure will be best most suited for you, we always have to do a consultation before the procedure.